everyone. Welcome to season 2 of Sarcoma Sisters. Woo! We're
Woohoo,
so
2021.
happy. 2021. So to kick off our season 2, we thought it would just be Wendy and I to talk about something that a few people have asked us to talk about and we think are really important too, which is second opinions. So just for a little bit of background, as everybody knows, now I work in the pharmaceutical industry. However, in the past, I worked for about 10 years at University of Arizona, which was what you would consider like a smaller center, meaning that we saw about 50 new patients per year. And so it wasn't unusual for people to ask me for a second opinion just because we were like a smaller place. And then Wendy has worked primarily at larger places. First of all, at Texas Children's, and now she's at Mayo, where a lot of people come for second opinions. And then, so we thought that it would be really good because we each have a little bit kind of different perspective, or I guess you would say maybe our experience with it. But then we thought we could hopefully offer some advice because we know there's a lot of anxiety sometimes, and just like, should I get a second opinion, yes or no? Either you feel like you should get one or else your family may be pressuring you, but there's always good reasons maybe to get one or not. So the first thing, that's what we're going to kick it off with. So I'll have Wendy start the convo with, should you get a second opinion?
Yeah. I think it's important to, like what you said, that we have a little bit of different experience. But even though I've been kind of at the larger referral centers, I have also definitely had patients get second opinions from other people or asked me my opinion of whether they should get a second opinion. And we have to remember, Lisa, to at the end also talk about when we ask other physicians for opinions.
Yes.
But so I think that the most important question, well, I guess, when I talked to my families at the very beginning, and I just had this conversation with a family yesterday, the number one most important thing is that we need to know what the diagnosis is. And so sometimes that second opinion question comes up at the very beginning. Sometimes it comes up in the middle after the diagnosis has been made, and sometimes it comes up towards the end. And so I always tell my families, they'll ask, like you said, Lisa, a lot of times people will say, well, my Aunt Betty said that I should get a second opinion. What do you think? And I always encourage people, if they feel like they need a second opinion, I can help them do that. And I can help them find an appropriate place to get that opinion. And so a second opinion is not always the right answer for everyone, I would say. Some people feel very comfortable with the team. They're already at a center that has expertise in sarcoma, or there is a person at a center that has that expertise and they feel pretty comfortable with it. And other people need extra reassurance. I almost think of it like, I like to price check things and make sure that I'm getting the cheap price. So that's just like a personality trait of mine, but not everybody does that. And so I think the answer is always yes. If you feel like you need to get a second opinion for your peace of mind, for your family's peace of mind, I think it's always a good thing to do. And so I think now I'm on the receiving end of second opinions more than I was in my previous institution. And we can talk a little bit about that. But the one thing I want to say is that second opinions are very, very helpful, both for the family and sometimes for the physicians. And people shouldn't be afraid to ask for them or share with their physician and their team that they are seeking one. And if we're open and transparent about those endeavors, it makes the opinion more useful, more valuable, and easier to obtain. And so some people feel like they're like cheating on their physician
in the relationship. Yes.
Get mad. And I think that is the minority of people who are the minority of physicians who will feel that way. And I think that's kind of a bit of a red flag to me. So most physicians are happy to help facilitate a second opinion. And you shouldn't feel like you're cheating on them. It's like cheating on your hairdresser, right?
Right.
You're like, I got a bad haircut.
Yeah, no, I totally agree. And I did my training at MD Anderson. So there, for my pediatric oncology, we had a lot of people come kind of like you do at Mayo for second opinions. But then when I was at University of Arizona, it was because, a lot of people, even in the beginning when they were first diagnosed, because they know what they read on the internet, which is true, that sarcoma is very rare. And so they want to make sure, of course, that their child or themselves are getting the best treatment. Um, so I agree. I think, just for myself personally, and like you said, like with hairstylists, with your own dentist, whoever else, you might feel like I can't go see someone else. But your physician, as physicians, we are here to help and to help you get that second opinion. And like you said, it's a red flag. It's not a good thing if your physician is offended by that, because that's showing an ego issue, not an issue with a second opinion, because we want you to also feel like you're getting the best treatment. And like you said, a lot of times it can be helpful for us too, on both ends of that.
Yeah. And I think I have personal opinions about this because I've seen kind of all sides of the spectrum, but there's second and third and higher order opinions also. And I wanted to see what you thought about that, Lisa, if you've been on the either sending or receiving end of more than one opinion, and how that can muddy the waters or clear the waters depending on what's happening.
Yeah, that's a great question. And I just want to say too, Wendy and I are both pediatric oncologists, so we're speaking from that perspective. Because we know some of our listeners may be more in the adult world of sarcoma, and they probably may have different experiences with this too. But just from our experience in pediatric sarcoma world, because it is such a small world, we're both, it means that everybody usually knows the people who are the experts in the country, or is familiar with their names. So it's kind of like a close-knit group. I think the other thing that's unique about pediatric oncology is that when someone is first diagnosed with a sarcoma, usually if it's a sarcoma that everybody is I should say more common sarcoma, like rhabdomyosarcoma or osteosarcoma or Ewing sarcoma, we all have a standard of care. So it's still okay to get a second opinion, but everyone is going to do the same thing. And there's nothing wrong with getting a second opinion, but in this instance that you're talking about, Wendy, where it would mainly be if somebody has a recurrence, and then the family's seeking a second opinion, and there's no longer what we call that standard of care chemo that everybody gets. So it could be many different things. It could be a clinical trial. It could be another combination of drugs that we're hoping has some activity to kill the tumor. So yeah, it's always kind of hard if because everybody wants the best opinion, but then I think what we all fall into with many decisions in our life that are tough, is that then we start getting multiple opinions from people. So whether it's one doctor or three doctors or four doctors, and then because everybody, even though they're experts, they have like their own different formulas and combinations they may have used. So if you start getting more than, I would say, 3 second opinions, then it almost makes it harder on you, because then you don't know which one is best. And it's not even that there is a best one. It's just that they are opinions, because in that scenario, it's not that one is necessarily better than another, but then it's going to put a whole lot of pressure on you.
Yeah, exactly. And I think that's the important distinction, is if there was one right answer, we would all
everyone say it.
Recommend that one right answer.
Mm-hmm.
I actually did you see this, Lisa, yesterday? I don't want to get into politics on here because this is not our podcast. It's not about politics, but Arnold Schwarzenegger just put something out on Twitter. Did you see that? And it was about science or whatever. And he said,
Mm-hmm.
if you have 5 people telling you one thing and you have somebody else telling you something different, you have to evaluate why 5 people would say one thing and one person would say the other thing.
Mm-hmm.
And so, that happens kind of like at the beginning of therapy, where there is that standard. And then you might have this one person over here, or this one family member who read something about, aloe or scorpion venom or whatever. And so anyways, I thought it was funny that, that came up of like, if 3 or 4 people tell you the same thing and one person says something different and it sounds better, like you might need to evaluate, why that one's different. But that happens at the beginning of therapy, not necessarily in that relapse setting where there are several options where we may or may not have a lot of evidence that one is better than the other. And so then in that setting, even though second opinions are still valuable there, somebody who really knows you or you and your child well to help differentiate kind of the lifestyle choices that come with those different therapies can be helpful versus somebody who's meeting you for the very first time.
Yeah, I was going to say that just brings it back to, I think, your point about why it's so important to involve your primary oncologist, because it's definitely okay to get more than one opinion. But the more you get, it might be more stressful. I think we both agree you probably shouldn't get more than 3.
Yeah.
Because then you'll just drive yourself crazy. Not that it's some magic number, but just what you said, it's so important to involve your primary oncologist because you've developed this trust and relationship with them, and they're going to help you. You can get the information from the other physicians who are very brilliant as well, but then go back to your oncologist who knows you and your family the best, who can then help you parse through the details and think what would be the best for your family at this point in time.
Yeah. And I think, from somebody now who is doing more second opinions than I had previously, having the information from the family or the patient is very valuable, and that can't be underestimated. But also having the information from the physician who has been treating that person previously is also very helpful, because there may be nuances to the way that person's body has reacted to things, or there are things that might not be crystal clear in the imaging reports that we're reading or the pathology. And it's not that things are inaccurate in the chart. It's just that, in the electronic medical record, it's only things that we put in go in there. And so there are so many times and so many conversations that happen outside that may or may not be captured, or they're only captured in one snippet of a note that might not get pushed to that receiving physician, that are extraordinarily important. And so having an overall gestalt of what has happened with that person or that patient, and then the nuanced details that we as physicians will know will be important for clinical trials going forward, or new therapies going forward, or et cetera, is really, really valuable. And for me, as somebody who gives second opinions, I feel like, I know I give a better opinion once I get the information from both the physician who's treated them and from the family or the patient themselves. And so I think you get a higher quality second opinion if you can get all of that information and be able to have the receiving physician talk with your physician and not just look at records. Because sometimes, especially if it's, unfortunately in that relapse setting, there may be years of records that somebody has to pour through. And, we all only have 24 hours in a day. And so that can be challenging.
Yeah. So Wendy, what do you think is the best way that a family can help to prepare for a second opinion?
Yeah. So I think the best, I think you're going to get the best high quality opinion if you talk with your you may have ideas about who you want to see or institutions that you want to go to. So for pediatric oncology, many people, immediately think of St. Jude, which is a great institution, and they have a great process for second opinions. For adult oncology, institutions that come to mind, to everybody's mind, are, MD Anderson, Memorial Sloan Kettering, probably Mayo Clinic. And so it may be a person or an institution, but if you're thinking about having a second opinion, I would say, go to your physician and say, hey, I'm thinking about getting a second opinion. I may or may not have these people or these institutions in mind. What do you think about that? Are these good people to go to or not good people to go to? Or is there other people I haven't thought of? And most people will have an opinion about where a good place to go is. And then I would say, prepare in advance and make sure that receiving institution or that receiving physician gets all of the stuff well in advance so they can look at it. I can't tell you the number of times that I have had somebody either show up with a stack of papers this big, which I cannot get through, and then like a CD-ROM of their MRI scans for the last 3 years. And it's not a good quality opinion. I can only do so much in that time. And so if we can get all of that information, a week in advance and be able to talk to the physician, then you're going to, when you come or you have your phone call or video visit or whatever, you're going to have a better quality opinion than just showing up with it or having it. Now that it's electronic, like they're like, oh yeah, the images are on the way, they're coming. And then they'll come like 7 p.m. the night before I have a full day of clinic, which is extraordinarily hard, especially since I'm not a radiologist and sometimes I need the radiologist.
Right.
So I would prefer, at least a week lead time so that I can adequately give the attention to the case that it deserves. That's my personal opinion on that.
Yeah. No. And then what kind of stuff or things do you think are most important for sarcoma second opinion?
Yeah. So different institutions do it differently. I think number one, if you can send the actual slides or blocks of pathology, histology tissue, that can be important. Every once in a while, we do look at it and our pathologists will disagree with the original diagnosis. It doesn't happen very often, but it's important when it does happen. And that kind of goes back to that conversation of sometimes it might be appropriate to get that opinion at the beginning because we really need to know that we have the right diagnosis. So I always like to review pathology or have my pathologist review the pathology so that I can be sure that whatever I'm saying is correct because the diagnosis has been correct.
Yeah.
So that is important. And actually some institutions require that before a second opinion can be rendered because there's so many ramifications of not having the right diagnosis. And then what is most helpful for a second opinion is if your team can provide a synoptic summary of, diagnosis, surgeries, chemotherapy, and any major complications so that it's easy to read and you kind of know what you're looking for. And then the rest of the radiology images and pertinent clinical notes. Most people can get those sent electronically now, which is nice. So you're not waiting for FedEx stuff. Obviously, like we talked about with Dr. Fitzhugh, the slides and everything still have to be FedExed. There's nothing like a glass slide. So that is oftentimes the rate limiting step. But
yeah. And the other thing you reminded me of was, COVID and the pandemic have wreaked havoc on a lot of parts of our lives, but there have been some small blessings because of that. So when I was at University of Arizona, many people couldn't, they didn't have the means, or it was difficult to go somewhere for a second opinion other than Phoenix. I'm in Tucson. Not that Phoenix wasn't great, but if you wanted to go somewhere else, it was a lot of times difficult. Where now in the time of COVID, a lot of places are offering, virtual consults. So I think that is something, and I don't know if that will change. We'll have to see how it all shakes out. But definitely, I think it's something to take advantage of, to be able to not get 10 second opinions like we talked about, but to be able to get opinions on the East Coast if you're in the Midwest or the West Coast and vice versa, to be able to take advantage to go get these virtual consults. And I think that's something that's really great that's come out of the badness of the pandemic.
Yeah, I wonder too how it's all going to shake out. For those of you that don't know, and I hope I don't get this wrong, but the declaration of a public health emergency relaxed the regulations surrounding like video visits and phone visits across state lines for Medicare, which the rest of the healthcare system follows the Medicare guidelines. And so they did that so that people and like telehealth was more accessible, so people didn't have to come to the hospitals that were already overwhelmed with COVID, and so people weren't kind of gathering and being in places and increasing the transmission rate. So where before we weren't allowed to say, if I was in Michigan, I wasn't allowed to see a new patient via video visit in Arkansas. But those rules have been relaxed. And I think the last I heard, Lisa, and I should probably pay a little bit more attention to this, the last I heard is it was still just this ongoing extension, and there was another 90-day extension of that. But I think it'll be interesting, and we have a new administration now, of how that may or may not continue to be something that is a part of our healthcare system going forward.
Yeah, definitely.
And it's kind of, at first, like when I came here, which Mayo Clinic was a pretty rapid adopter of video visits and whatnot. At first I was like, I don't really know how I feel about this.
Yeah.
It's weird. But I'm getting more and more used to it, and and it's kind of nice because, like, right now, the other bonus of it is there's a lot of rural areas around where I'm at right now, and there was this snowstorm last week, which I couldn't get up the hill in my car. But anyway, one of my patients was like, I don't want to drive with my kid in the car. Like, can we just get labs locally and have a video visit? And it was great because I'm like, that's awesome. You don't have to spend an hour and a half on these icy roads and like end up in the ditch with your child who's going through cancer therapy. I think that's a win-win.
Yes, definitely.
So we'll see what happens with the video visits, but
yeah,
there's a possibility they might go away.
Right. Yeah. And I know something else we want to hit on was the different types of second opinion. With you bringing up St. Jude, that's what reminded me of that. That you could either have in person or video where you're talking to the physician, but then there's other types, which do you all offer that too, like St. Jude does? I'll have you explain it a little bit better, the other types.
Yeah, so there are institutions, I think I saw something recently that MSK does it too. So telehealth is phone visits or video visits with the patient. And then there's, we call them e-consults here, where it's basically another physician. So like, Lisa, if you had a question and said, I'm treating this patient this way, like, would you do anything differently? You can send in a request for an e-consult for us to review the case and render an opinion back to the physician. So that is formalizing something that is often done just on a professional courtesy between physicians, which I've always kind of called them curbside opinions. We do it in the hospital with our own people, like, hey, by the way, I had this like weird bacteria grow from my patients, whatever, like, what do you think? From colleague to colleague. But then as an oncologist, Lisa, I know I've called you before, I've texted you, I've reached out to people who are more senior to us and said, hey, I have this case, this is really interesting or complicated, or I'm just not sure, have you ever seen anything like this before? What would you do? So there's always been that kind of professional back and forth with physicians, and the e-consults, I see it more as a more formalized way. And it's a way for people who don't necessarily know kind of the people in the world personally or professionally to access those resources also. So I also get international e-consults. Like I did one from Egypt the other day. And so that's been a nice thing that's, I think that's new with the pandemic too. I'm not actually sure. No, it's not, because St. Jude's been doing it.
Yes. Yeah. And so you would basically get all the same information that you would as if you would see the patient face to face, but then that's the part that you're not doing because you're communicating directly with the physician.
Right.
And then you review it like at what we call tumor boards, where the pathologist is there, the radiologist, radiation oncologist, the Wendy, the oncologist, and you would all discuss the case and make a formal opinion and then send it back.
Yep.
And that's good too, because it's in their record then too, like they have that information to carry on if they need it in the future or that kind of thing.
Right. And I've had people ask me to send that information in when I was at Texas, and I'm sure it'll happen here. I just haven't been here long enough. But at that, oops, I froze a little bit. I've had people ask me to like compile that information and submit it for an opinion from St. Jude, and it's fine, and we get the information back and go from there.
Yeah. And I think just one other thing that I wanted to maybe touch on a little bit was when you're getting these second opinions, a lot of times you may be looking specifically at a clinical trial or thinking about a clinical trial, and maybe just talk a little bit about those. Because I think that's sometimes a lot of pressure and decision making, especially if you hear, well, there's just one slot and all these things. So I feel like we have talked a little bit about clinical trials, and I know we're going to have some guests this year that are experts in creating and clinical trials. And I work on clinical trials every day now, but but I guess I just wanted to say, that it's always okay. First of all, again, your primary oncologist can help you figure out if clinical trials are open in the type of cancer, type of sarcoma that you have, and then what are those and are they accessible? Because that is one thing where you would have to travel to get this drug because it's only offered at that site, and you might not have to stay there the whole time. It might be a back and forth kind of thing, but also, hard during the pandemic, but still something to consider. And I think just like with a second opinion, it's usually part of a second opinion, it's important to get all the information and then talk to your primary oncologist about it. I don't know if you have any extra, I mean, I could go on, but I'll take a break. Let's see. So it's just so it doesn't sound like I'm just blathering on.
Yeah,
Your thoughts on clinical trials, especially because, Texas Children's, of course, was big for clinical trials too.
Yeah, it's the world of clinical trials, is kind of, I guess it lives in that second opinion realm, but it's just a little bit different. And I do feel for our patients because it's hard to find the information about clinical trials. There's of course clinicaltrials.gov, which lists active and closed protocols too, but those sites, it's very hard to tell.
To navigate.
Yeah, it's hard to navigate. It's hard to tell if the trial, like it says the trial is open, but that doesn't always mean that there's a spot available. And so that's a tricky nuance. And then, for somebody who doesn't do this every day, just looking at the eligibility criteria and understanding if you're eligible for that trial can be challenging. And so that's again where your primary oncologist is really important, because they may be able to reach out to the principal investigator of that trial to see if there's spots open. They can look at the eligibility criteria and tease through what's available or what's not, or what you're eligible for and what you're not eligible for. And I will say that even though I try to stay very up to date on clinical trials, I have 100% had patients come to me and say, hey, I'm thinking about this trial. What do you think? And I haven't heard of the trial. So even though I live in the sarcoma world, like I'm just one person, I can't possibly stay up to date on all the, hundreds of things that are happening every day, things opening, closing, and new things. Try to stay best as we can. So if you find something you're interested in or you hear about, take it to your oncologist. I always feel a little bit like, ooh, I wish I had known that, but I am human too, and I am prone to.
You cannot know everything. None of us can.
My own resources. So but then it's easy for those people to reach out and say, hey, is this available? Because what you don't want to do is end up traveling and then realize that you were never ever going to be eligible, and you've wasted time, money, resources, mental space, whether that be a space of hope or whatever. Like, don't waste your mental space on it if it's not something that's going to work out. So we definitely always encourage you to talk to your oncologist about anything that you find, and don't assume that they know it, all the trials that are open, because it's really hard to stay on top of.
Yes, definitely. Yeah.
And there has been lots of talk about trying to, clinicaltrials.gov is centralized, but there's been talk about, trying to get an easier system or a sarcoma specific system, but I don't really see that happening anytime soon.
Yeah, I know.
It's just hard to keep it updated.
Yeah, because there is so much going on for sure. Yeah. No, I think that's really helpful. And like I said, we'll be talking about that more at clinical trial specifically, but I know that's something that comes up a lot with second opinions. And a lot of times that's what you're looking for, is something that's not offered at your center, you know, and that may be why you're seeking it out.
Right,
Yeah.
right.
I think, was there anything else, Wendy, we were going to touch on? I'm just looking at my list over here. I think that was mainly everything.
I think so.
I hope you all found this useful.
I know. I know. I will say, you know, I guess the one thing, since, you know, we did talk about it, if you are listening and you find a center where you want to talk to a certain person or have a visit with them, because of the world we live in now, I would specifically ask, you know, would you be willing to do this via a telehealth visit for the first visit? Because I mean, let's be honest, you might meet that person and be like, I don't want that person to be my doctor. You know, you never know.
That would never happen with us, of course, but you know, with other people.
Never. But you know, I think that is a good way to meet at least one of the teams, you know, hear what they have to say, hear how they explain things, without having to go through the airports and all that stuff now.
Yeah, definitely.
So I hope that it continues. I think it's better for our patients. I hope
me too.
That remains a possibility. I think it's good for people who live in less populous areas. I think it's good as we continue to try to get this pandemic under control. And I think it allows access to expert care that used to be kind of inaccessible.
Yeah, definitely. All right. Well, thanks everyone for joining us for our first season 2, 2021 podcast. Woo woo. And we'll bring you lots of exciting, great guests this season. Our goal is to get one in a month. So, you know, hold us accountable. We're going to do it. And yes, thanks all for joining us. Bye.
Bye.